Clerk, please take the roll.
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant, Hakeem, Hall, Helton, Hicks, Jernigan, Kumar, Marsh, Mitchell, Ramsey, Sherrill, Smith, Bond, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry. Mr. Chairman, you have a quorum.
All right, thank you. Before we get to today's business, do any of the members have any personal orders? Okay, seeing none, we've got a calendar with, I believe, 8 items on that. Without objection, item number 7, House Bill 1088, has been asked to be rolled 1 week. Okay, that brings us to the start of the calendar. Item number 1, House Bill 555. Chairman Johnson, you are recognized. You have a motion and a proper second.
Thank you, Mr. Chairman. House Bill 555 renews the annual allotment of 125 new Medicare skilled nursing facility beds through June 30th, 2025. It also gets rid of some obsolete language and allows 3 years instead of 2 years to complete a new CON approved project.
All right, thank you. Any questions for the sponsor of the bill? Okay. Seeing none, we are going to vote on House Bill 555. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chairman and committee.
Thank you. All right, that brings us to item number 2, House Bill 710. Representative Hurt, you are recognized. You have a proper motion. Second.
Thank you, Mr. Chairman. House Bill 710 seeks to make reopening our closed rural hospitals a little simpler for communities when they have the opportunity, when they have an interested party coming in and trying to reopen. So present law generally requires that a person obtain a certificate of need before establishing a healthcare institution, changing the bed complement, or instituting certain healthcare services. This bill creates an exception to present law whereby a certificate of need will not be required for a licensed hospital if the hospital was previously licensed or another hospital was previously licensed at the proposed location. The hospital is located in a county that has been designated by the Department of Economic and Community Development as a Tier 2, Tier 3, or Tier 4 enhancement county, or that has a population less than 49,000. 3, the last date of operation at the hospital site service area or proposed hospital site service area was no more than 15 years prior to the date on which the party seeking to establish the hospital submits information to the Department of Health pursuant to this bill. And number 4, the party seeking to establish the hospital applies for certificate of need from the Health Services and Development Agency within 12 months of the date on which the party submits information to the department pursuant to this bill. And with that, I'll take any questions.
All right, do we have questions for the sponsor? Okay, I do have one for you. There is a comprehensive bill that came through subcommittee yesterday. Is this language included in that bill, or what can you tell us about that?
That was brought to me by the Senate sponsor, and I think over there it was rolled or covered. I'm not real clear. I believe it does maybe include. I think we may have, but I wasn't clear and didn't want to miss anything with running this legislation.
Okay. I'm going to go out of session here real quick and have Matt King with Legal Services talk to us.
Matt King from the Office of Legal Services. The bill being referenced is House Bill 948. That is the Certificate of Need Reform Bill. And the large amendment that is was considered in subcommittee when that bill passed out of subcommittee was Amendment 6091, and this is included in that large amendment.
All right. Any questions while we are out of session for legal? Okay, we'll go back into session. Okay, any questions for the sponsor on this? I guess my question to you is I'd like to ask your intent. I mean, obviously it's in the big bill. Would it be your intent if we pass this out today just to hold it and see? I mean, you've obviously made the comprehensive one. Your idea has made that. and you've helped craft that. Is that your intent?
Absolutely. And again,
Okay.
I'm at the will of the committee. I would have the intent of letting it sit if we can get it through this committee to see where the other legislation goes and make sure we're covered on it. And if we're covered on it, we're good.
Okay, perfect. Thank you. Chairman Boyd, you recognize?
Thank you, Mr. Chairman. The sponsor, I was actually going to say, if you could park that thing in calendar and rules, there are a few other bills that we've seen out there that would be addressed in that comprehensive CON bill, and their intent is to park them in calendar and rules and make sure that this one gets passed. And if it doesn't, then move forward with the one that addresses their specific issues. That's what I'd recommend.
You recognize?
Absolutely. I'll be glad to do that. And thank you.
Thank you. Any further questions on the bill? Representative Alexander?
If a hospital opens back up and then they apply for the certificate of need in 12 months, I think number 4 says, what happens if they don't get it?
Representative Hurt, you recognize?
From the way I understand, they wouldn't make that commitment or that investment until the certificate of need. The intent would be there, and then they would possibly be moving forward. But from the way I understand it, they would not open fully until they receive the certificate of need.
I just think it's a big investment. for some
Absolutely, yes, ma'am.
That might not get their certificate of need.
Right.
Yeah.
Any further questions for the sponsor? Okay, seeing none, we are voting on House Bill 710. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to government operations.
Thank you, Mr. Chairman and committee.
Thank you. All right, that brings us to item number 3 on the calendar, House Bill 1181. Chairman Rudd, you're recognized. You have a motion, a second.
Thank you. And we also have a amendment traveling with the bill from subcommittee 5537 that makes the bill.
Okay, you have a motion, a second on the amendment. You're recognized on the amendment.
Thank you. What this amended bill does is the legislation is traveling with the bill, and subcommittee makes the bill. For reference, 5537, what it does is this is a result of working with the hospitals and health department, the amendment. It removes hospitals from the bill since they already have policies in place that reflect this legislation. The bill also states that if these policies do not reflect the legislation, they would be included in the bill. They would not be excluded. This also puts rules for the health department to go by guidelines. We've worked with the hospitals and the health to formulate this. This legislation strives to extend the same rights and dignity to a deceased surgically aborted unborn child, the same respect and dignity granted to any other human being. It would be the responsibility of the parent or the facility to select either cremation or burial of the fetal remains. It would also be the responsibility to cover their costs. The estimated cost to bury an aborted fetus would be approximately $350, $150 for cremation, $150 for an open grave, and most crematoriums do not charge for cremation of aborted fetuses. The legislation is based on Indiana similar law that has survived a court challenge. Currently, there are 11 states with similar legislation in place. Tennessee code requires pets and animals to be disposed of or burial or cremation, but there is no such law enacted in Tennessee for aborted fetal remains. I think it's time that Tennessee step up and give the same level of dignity to a dead pet as they do a human being. And with that, that's what this bill accomplishes and what it aims to do. It does not in any way restrict an abortion or access to an abortion facility. It only deals with the aborted surgical remains of a child.
All right, thank you. So we are on the amendment. We have Representative Freeman, you are recognized.
Thank you, Chairman. You mentioned that you work with hospitals and believe that that what you're requesting is already part of their practice. Which hospitals did you speak with? And
The Hospital Association.
so
You're recognized.
and they stated that the hospitals already, this is their practice currently.
Yes, to deal with, of course, they do not do, most hospitals do not do elective abortions. This is fetuses that are aborted while patients are in the hospital, either due to surgery, the life of the mother. They do not do elective abortions. And if what happens in the hospital when there is a baby aborted, or a baby that dies, they send it either one of two things. They either hand it to the parent for their funeral home, or it goes to the morgue. And if it goes to the morgue and it's unclaimed, then the morgue cremates it.
Any further questions? Okay. Speaker Marsh, you recognize?
Thank you, Mr. Chairman. My question is about the burial. I know we talked about it last week in subcommittee. If the mother wants to take the aborted fetus with them, can they bury it in like the family plot or in their home or in their yard? Is that prohibited or is that okay?
Chairman Rudd, you recognize?
Today, it's my understanding under current code, since that's not in code for an aborted fetus, they can request it as like you would take a gallstone or a organ that's been taken out and put it in a jar and leave with it. This is actually put it in code to give that baby some rights and some dignity so that it's treated like any other human being.
Okay. Representative Clemens, you recognize?
Thank you, Mr. Chairman. A few questions on this amendment that makes the bill. I want to return back to the question about the hospital exclusion. What is your understanding that the centers or healthcare providers that you're attempting to regulate with this legislation doing differently than hospitals?
Chairman Rudd?
Currently, it is, thank you, Mr. Chairman. Currently, is the practice of nationwide, which is why we have testimony from people around the country here today to explain what happens, not just here, but everywhere. It's been my expert witnesses have told me that worked in the abortion industry and worked in these clinics is that babies are disposed of by probably three means. One, they are ground up and flushed down the toilet or the drain if they're small enough, and like a garbage disposal. Other, they are put in a surgical bag and disposed of with the rest of the surgical trash, or in some cases, they're simply put in a trash can and put out to the curb. There's also a fourth. Sometimes the babies are frozen to be disposed of by other means.
Representative Clemens?
And excuse me, and also I'll say that, and none of this is it policy that the mother is asked how to dispose of it. The mother usually leaves. That option is not given to her. This is legislation would actually give a mother a choice, the parents a choice how to dispose of their aborted child.
Representative Clemens?
Thank you, Mr. Chairman. So you said nationwide. Can you tell me a single entity in this state that is doing any of the things that you just alleged?
Representative Rudd?
Specifically.
Chairman Rudd?
Well, there are 3 abortion clinics that I'm aware of in Tennessee. One operates part-time. The other 2 either operate full-time or part-time. My witnesses can address that. They're experts on that. As far as I know, the abortion clinics, the elected surgically aborted children here are treated the same as they're treated everywhere. And one of the procedures the witnesses will testify to is once a baby is aborted, to make sure the mother does not get infected, the body parts are taken out, taken to a separate room, reassembled, and they're counted to make sure they're whole and nothing is left in the mother, and then they're disposed of by the methods that I just described.
Representative Clemens?
And this information is based on representations to you of third parties. You've never seen this or experienced it.
Chairman Rudd?
I've never been in an abortion clinic. This is from the testimony from former Planned Parenthood workers and other abortion clinics that did it themselves and participated in it themselves.
You're recognized.
Thank you, Mr. Chairman. Right now, as the law stands, if a woman makes the difficult decision to have an abortion in the state of Tennessee, is she prevented in any way from having those remains cremated or buried upon her request at one of these facilities?
Chairman Rudd?
No, not to my option. Not that I'm aware of, no.
So there's no instance of any of these facilities preventing a woman who chooses to do this currently from burying or cremating the remains?
Chairman Rudd?
I've not accused them of preventing a woman. I've just said that is not a normal option of disclosure of how. This would require the clinics to actually, the facilities to actually ask the mother or the parents how they want to dispose of the child by cremation or burial.
Representative Clemens?
And so I saw in the bill where it would be, in some instances, the woman's responsibility to pay for this cremation or burial. And so in doing this, not only does the Tennessee law and code have extreme limitations on the ability of a woman to make the decision with no excuse for rape or incest currently under the law. There is a situation where you could have a young woman who was raped by her father choose to get an abortion and then have to pay to bury the remains? How is that appropriate?
Sure.
You want to, please respond.
Well, first of all,
Chairman-
as I've
Chairman
said
Renner.
earlier, regardless of how someone wants to change the argument on this bill does not address abortion. It does not limit abortion or access to an abortion. It does not fine for abortion or in any way discuss the actual abortion process. We only cover how the human being that's been aborted is treated. And someone has to take responsibility. It's a minimal cost. Also, either the abortion facility will pay for it, or the mother or parents will pay for it, or in some cases, as my witnesses will say, there are charities that will pay for it.
Representative Clemens?
Thank you, Mr. Chairman. I appreciate this. I just have two more questions. Again, me as a father, anybody in here as a father who has a daughter, if they were raped and they choose to get an abortion in the narrow window of time that it's actually allowed in Tennessee without being criminal, you're going to make me as a father or my daughter pay for that burial or some other thing and make my child go through that? That's what this law does, because what this law requires, and while I understand the limitations of this law, it must be viewed in context of all the other laws, the cumulative impact of all those laws and the burden it puts on women who are making a difficult decision. And I would just simply ask the rest of my committee members, consider these situations and these unintended consequences or intentional consequences of this legislation and what we seek to do here to women going through a very difficult time. We've established in this short question and answer period that women are not prevented from having the remains buried or cremated upon their request. We've established that hospitals have an exclusion, even though there is no proof that the facilities being regulated are doing anything different than hospitals that are expressly excluded by the amendment. This simply is another attack on women. I would ask my colleagues on this committee to strongly consider the offensive and hostile nature of this bill towards women and their constitutional rights. Thank you, Mr. Chairman.
All right. Thank you. We have other members here that do want to speak. I do want to go out of session. There we got several people here that want to testify, so it may answer some of the questions that members do have, but I do want to get a clarification when we go out of session. So without objection, we're going to go out of session. Matt King, could you, Legal Services, could you read a section of the bill to us?
Matt King from Office of Legal Services again. The subsection, I believe, in question, Chairman, is subsection H, which deals with the payment for the cremation or interment of the fetal remains. Subsection H has two subdivisions, H1 and H2, and they read as follows. Subdivision H1 states, except as provided in subdivision H2, an abortion facility shall pay for and provide for the cremation or interment of the fetal remains from a surgical abortion performed at that facility. Subdivision H2 reads, if the disposition determination made under subsection D or subdivision E1 identifies a location for final disposition other than a location provided by the abortion facility, then the pregnant woman is responsible for the costs related to the final disposition of the fetal remains at the chosen location.
All right. Thank you. So we have several members here, there are several folks here that do want to testify on this. So while we're out of session, first person to testify, Will Brewer with Tennessee Right to Life.
Thank you, Mr. Chairman, members of the committee. Will Brewer, Legal Counsel and Director of Government Relations for Tennessee Right to Life. I think that myself and my organization have a reputation in this committee year in and year out for coming here and advocating for smart, legally responsible pro-life bills. We don't throw our endorsement to just any bill. We make sure that the bills that we endorse have the utmost chance of succeeding in a legal challenge in court, because as history has told us in the last decade, pretty much every pro-life law that we pass in this state is eventually challenged in court. And we want to make sure that if our laws are challenged, that they have the greatest chance of success. This bill has been crafted to mirror Indiana's law that they passed several years ago. That law was taken to the U.S. Supreme Court, and it was upheld in a 7-2 decision. And that was before Justice Barrett was on the court. So that meant that Justices Kagan and Breyer, who typically do not side with these types of bills in their reputation, upheld this law by Indiana. And my organization, I myself, in consultation with other attorneys from across the country, have vetted the language of this bill. It mirrors Indiana's law as closely as it can to still be applied to Tennessee. There is nothing in the language of this bill that requires a woman to pay for the disposition of the remains. It is her choice, firstly, if she wants to personally dispose of the remains, she has the ability to do so. But if she declines to do that, there is no further questioning or responsibility. She is free to leave the clinic, and at that point, it becomes the abortion facility's responsibility, both logistically and financially, to dispose of those remains. So in no way does this bill produce a burden on the patient unless that patient voluntarily assumes that burden herself. And with that, I'm happy to take questions.
Representative Clemens, you're recognized.
Thank you, Mr. Chairman. I was just simply going to make a point of order that the witness stay on the bill as opposed to opining on his constitutional opinions. Thank you.
Thank you. Representative Chairman Jernigan, you're recognized.
Thank you. A quick question. The bill, so you said that the mother has a right to choose, is to choose between two options. Is that correct?
You're recognized.
It is my understanding from the bill's language that the abortion facility provides the woman with the option to bury or cremate her own child. If she chooses that option, she can either arrange that disposition herself, or she can arrange it through the assistance of the abortion facility and whatever logistical means, but she is a part of that process. The second option is that she denies, she either chooses not to be a part or she refuses burial or cremation. And at that point, she is free to leave this process. And at that point, the abortion facility is then tasked with the responsibility of disposing of these remains.
You recognize.
So if she refuses the two, then say she wanted to have it for medical research, she's free to do that. Is that correct?
It is my understanding that she is free to do that. If she wants to dispose of it in a dignified way, she is free to do that. The purpose of that language and those alternating provisions is to explicitly eliminate the idea that we are burdening the woman because she is free to leave that decision-making process entirely.
Okay, I understand. Thank you.
Thank you.
Representative Freeman.
Thank you. So continuing down the same thought process, and with the understanding that because hospitals are currently doing this, are we now going, because I would assume a hospital is going to charge the family for whatever the services that we were told they're already performing. So will the hospital now not be able to charge the patient for this?
I'm sorry, if you could just rephrase your question.
So you're saying that today, or the sponsor earlier said that today hospitals are already following this two-step process or the two-option process. And I would assume they're charging when they do that. I would assume they're charging their patient. And so would this create a situation where someone in a hospital setting could just say, I'm not paying you for it. It's your responsibility to pay for this?
That would be a question for the hospital association. They're the ones that consulted the sponsor on that provision, and I think they have more knowledge on that provision than I do.
Any further questions? All right, thank you for your testimony.
Thank you.
All right, we have on the list members from And Then There Were None. It looks like an Annette Lancaster, Kelly Lester, and Elizabeth Matery. And just for the record, make sure that you say your name in the microphone and tell us who you're with.
Yes, sir. Yes, my name is Annette Lancaster. I'm with And Then There Were None.
My name is Kelly Lester. So I'm with And Then There Were None. Can you hear me now? Okay.
Yes.
My name is Kelly Lester. I'm with And Then There Were None and Pro Love Ministries.
My name is Elizabeth Mattori. I'm the Vice President of Government Relations for And Then There Were None.
Thank you.
Thank you for hearing my testimony today. I have had the pleasure of meeting some of you already, but most of you I have not. My name again is Annette Lancaster. I hold a master's in healthcare administration with 20 plus years of experience, and I'm a doctoral candidate for organizational development and leadership. Currently, I am the director of clinical placements for the Masters of Nursing program at one of the top nursing schools in our nation. Last week was the first time I testified ever in front of legislators about my time working in the abortion industry. I've spoken to pro-life sponsors, I've done interviews, and even spoken at conferences, but testifying to this body was one of the most significant experiences of my life. No part of that testimony or my experience was easy, but as the Bible says in Isaiah 6:13, the Lord creates beauty from ashes. As real as products of conception rooms are, it is always disheartening to hear that some people would question the authenticity of my testimony. Hearing about how I pieced back together tiny baby parts to ensure that everything was removed from the mother's womb is not easy. And it was not easy for me to perform those tasks, but it was part of my job. But I cannot change my truth. Regardless of whether an abortion happens at 5 weeks or 24 weeks, there will be fetal remains that must be disposed. After I identified the body parts, I would then take the fetal remains out of a Pyrex dish and throw them all together in a trash can that was lined with a red biohazard bag. These red bags were then kept in a freezer that we sarcastically called the nursery, until they were picked up by a biohazard waste company, which was every 2 weeks. The babies were not separated as individuals. They were not separated as specimens, which in itself can cause a plethora of other issues down the line. The main reason why I traveled here from North Carolina again to testify this week is because I want you to know the ugly truth about abortions. This is not sensationalized and this is not for shock value. I implore you to allow these fetal remains to be treated as humans and not as waste. Currently in North Carolina, women are not even given the option. They do not know that they have an option. And it is the same in Tennessee. I'm happy to answer any questions that you have about products of conception or the truth about the fetal remains if you have them. Again, thank you for this opportunity.
All right. Thank you for your testimony. Do we have any questions? Representative Smith, you recognize.
It's good to see you again.
Thank you.
And on behalf of me and the sponsor, thank you for distinguishing already in your testimony and establishing the difference between medical waste and a baby. And the fact that as a result of conception, it's a baby. It's not medical waste, it's not fetal cells, it's not a clump of cells, it's a baby. And so I want to thank you for establishing that early in your testimony, and I can't wait to hear from your colleagues. And I want to thank the bill sponsor that here in the state of Tennessee that we're going to codify that from the moment of conception, that we treat this issue as an unborn child or a preborn child that has unfortunately met its demise, but it's not medical waste. So thank you, Mr. Chairman.
Thank you. Any further questions? Okay. Representative Sherrill, you're recognized.
Thank you, Mr. Chairman. Last week, we asked a question about how many abortions are performed in the state of Tennessee and how many abortions are performed in the United States. Can y'all have that number this week?
Yes, sir. So in the state of Tennessee, there are over 10,000 that are done.
Last year.
Yes, last year on the books that was reported, over 10,000.
In the United States, do y'all have that number?
I'm sorry. Pamela Whitehead, the next person who is going to speak on a separate nonprofit, has more of the facts and figures of countrywide numbers. But we did, of course, look at the numbers for your state. That's only 2 surgical abortion clinics perform more than 10,000. So that's 5,000 for each. That means 200 a week. That means 100 a clinic. That means 50 a day because they only do it twice a day. So those are the facts and figures for last year's Tennessee.
Thank you, ladies, and I appreciate you coming today to testify. We appreciate you very much. Thank you.
Thank you. Representative Clemens, you're recognized.
Yeah, so quick question. You're telling me that 50 surgical abortions occur a day at a single facility?
If you only have 2 approved surgical abortion facilities in Tennessee and you have by record 10,880, you have to divide them by 2. Hospitals don't perform elective abortions. So that's how you
You
do
sure
the
about
numbers.
that?
They're not performing elective abortions.
In the state of Tennessee,
Mhm.
if a woman's having a miscarriage,
That's not an abortion.
correct?
That's not an elective abortion.
Let me finish.
Yes, sir.
You're
If a
recognized.
doctor advises her that the heartbeat of that baby is going away and that baby is going to die inside of her, you're telling me she cannot choose to have an abortion prior to that baby dying in her womb in a hospital?
You're recognized.
The 2 women next to me worked at the abortion facility, so they can speak to that fact.
In those instances, those women are referred to an abortion clinic.
I would respectfully disagree. I would respectfully disagree.
Mhm.
Any of y'all can answer this question. Fetal remains is defined in this bill as an aborted fetus or fetal tissue that results from an abortion of an unborn child. What word would you use to describe the same as a result of a miscarriage?
A miscarriage.
You're recognized.
Oh,
Are you referring to the remains?
Yeah.
It would be fetal remains.
But that's not how it's defined in this bill, so how would you define it?
Can you rephrase your question?
If a
You're
woman has a
recognized.
miscarriage,
Mm.
what are those remains called?
Fetal remains.
But that's
it's a
not how it's
human.
defined in this bill. Do you have an opinion on that? Why not?
No, I don't.
Thank you. That's all I have right now, Mr. Chairman.
Thank you.
so do you do?
You're recognized.
So Kelly Lester will speak. Kelly and Annette worked at abortion facilities, but I just wanted to clarify why I'm standing here and sitting here with you. As of 2015-16, I was a very active pro-choice Democrat. I stood for Planned Parenthood through my 2014 race to state delegate. I was one of those active, staunch defenders of abortion, women's right to choose. The only reason why I am 180 on this issue is because I actually thought more about the logistics of what abortion actually was. Even though I wasn't working in the abortion clinic, I was a part of the abortion industry because I was one of the activist advocates. So I, to this day, don't know the ins and outs of the abortion industry because they're purposefully kept secret so that Democrats, liberals, progressives, women in college, women in law school, Howard University School of Law, class of 2006, will defend it to death. But the moment that we articulate fetal remains, baby, your child, you're a mother, oh, guess what? You're a father. That's when the argument stops. So I have not spoken about my personal testimony, but I just wanted to highlight the entire industry is cloaked in muck and secrecy to a point where a JD MBA, DC native, nominated for Congress, still will never know the details. And so that is why our abortion clinic quitters travel so that the truth can be heard across the country, wherever the truth needs to be heard. Thank you so much.
Representative Hall, you recognize.
Ladies, I just want to say thank you for your courage. Thank you for stepping up. Thank you for making the trip to the great state of Tennessee. I appreciate you. My apologies for my colleague for attempting to use you as a verbal piñata. It's not going to happen. It's not going to happen here. You're going to be treated with dignity and respect.
And that's what we want for these human remains.
Thank you, ma'am.
Thank you. Representative Mitchell, you recognize.
Yeah, Mr. Chairman, I just wanted to clarify. I think my colleague was just asking questions. I respect your rights to have your views, the witnesses. I just wish you had as much respect for the women who are walking in a different set of shoes sometimes and have to make difficult decisions. And let's not be as judgmental on those folks. But I don't think my colleague from Davidson County was rude to anyone. I think he was just asking questions. And this is a difficult subject, and it's going to be difficult questions for both sides. And if you don't want to hear difficult questions, you may want to stay out of difficult areas. Thank you.
You may respond.
What is your name, sir? I didn't get his name.
I didn't get your name. I'm Representative Mitchell.
Representative Mitchell. My name is Elizabeth Felicity Mattori, JD MBA. I counseled 3 of my friends through abortions. I was personally pro-life, Catholic strategy, personally pro-life, but women's right to choose. That is what most Catholics walk through both Democrat and Republican parties for the last 50 years. I personally did have to counsel 3 of my friends. One of my guy friends, girlfriends, had an abortion. He no longer has a child. So we specifically appreciate this issue so wholeheartedly that we just want more people to hear more of the truth. That's all we're asking. Thank you.
All right, thank you. Appreciate you guys for coming today. Okay. Kelly?
Yes,
Is it
sir.
Kelly? Okay, you may speak. You're
Hello.
recognized.
My name is Kelly Lester. The women beside me have great accolades and educational achievements. My accolades are a bit different. I'm a former abortion worker. I am a rape survivor. I'm a domestic abuse overcomer, and I am post-abortive. I am now the mother of 6 children. I'm a wife, a volunteer in my community, and I advocate for those going through experiences like mine. Although it is difficult to tell, you need to hear my testimony because I have been on all sides of this abortion debate. I have been client, I have been employee, I have been a pro-life advocate, and my experiences, Representative, are like many women faced with the difficult choice of abortion. While I grew up a somewhat privileged childhood, I also experienced a life of violence. At 4, I was molested. by a family member. At 12, I was raped at a party. And at 15, I walked in alone for my first abortion. There was no parental consent given. There was no discussion about options, and there was no explanation of potential risks or side effects. There was also no discussion about what was going to happen to my baby after being torn from my young body. And this was in a state that required all of these things as a standard of care for abortion. This day changed my life. Before this day, I had early acceptance to college. I was a nationally ranked athlete and a regular church attender. After this day, I barely passed my senior year of high school. I quit playing sports, stopped going to church, and I eventually began using drugs. I began running drugs up and down the East Coast. I developed an eating disorder and was in countless abusive relationships. Interestingly enough, I later worked at the very clinic where I had my first abortion. I hope to escape the chaos of my life and do something to help women. My job as receptionist was to fill the appointment book, prepare the reception room, and oversee the recovery room. Part of this was editing magazines to make sure that nothing would change these women's mind from why they had come to us: abortion. We often bypassed laws, we shortcutted regulations to prevent shaming the women we served. The reality is that where there was not strict requirements of reporting, we blurred lines and we cut corners. This fetal remains bill is another step in guaranteeing that there is proper accountability for these women. Where are the 10,800 babies reportedly aborted last year in Tennessee? I had 2 more abortions after this, where the dads wanted to keep the baby, but my body, my choice, left them with no voice in the matter, and they now have nowhere to go mourn the loss of their child. There are many victims in the violence of abortion. While this bill does not lessen the number of casualties, it may potentially bring closure and healing to not only the mother, but the father, grandparents, and possible siblings of the child. Abortion is an ugly reality for many, myself included, but it is your job to protect the dignity and humanity of those you serve. Thank you.
Thank you. Thank you. Any questions? Okay. Okay, Representative Gant, and again, for the members, there will be respect, and there will not be a running debate. So, Leader Gant, you're recognized.
Thank you, Mr. Chairman. You said you worked in an abortion facility. Is that correct?
Yes, sir.
What happened to the fetal remains?
You're recognized.
I did not work in that area of the clinic, so I can only tell you from what I saw. I didn't actually work in the POC room, but they were put in medical waste bags and disposed of with medical waste.
Thank you, Mr. Chairman.
Thank you. All right. Thank you, ladies, for your testimony. Appreciate you coming today. Very powerful testimony. Thank you so much.
Thank you.
We have a Pamela Whitehead, I believe that is on our list to testify. And for the record, say your name into the microphone and who you're with.
Sure. My name's Pamela Whitehead. I'm a U.S. Army veteran, a former medical laboratory technologist with 20 years of experience, and I'm now the executive director of Pro Love Ministries. Today, I'm speaking from my own experience.
All right, thank you. Try to keep your comments down to about 3 minutes.
Yes, sir.
Thank you.
I had an abortion on September 8th, 2001. I was 13 weeks and 4 days pregnant, and I left that abortion facility in an ambulance because the doctor perforated my uterus and I hemorrhaged. My baby had arms, he had legs, he had a head, and he had a heartbeat. He moved and he kicked on ultrasound. What I don't know is what happened to his remains that day. What did they do with him after they tore him to pieces and suctioned his little body out of my body? Did they piece him back together? Or did they throw him down the garbage disposal? Did his little parts get mixed in with the parts of the other children who died that day, as my colleagues spoke about? No one asked me what I wanted done with the body that was taken from my body. I had no choice in that matter. I wasn't informed. And failing to obtain a proper informed consent by law is battery. And that's exactly how I felt. I felt assaulted that day. Roe v. Wade is the law of this land based on the 14th Amendment right to privacy. But I submit to you today that women have not been given a right to privacy. We've been given a right to secrecy. And privacy and secrecy are not the same thing. You have an opportunity today to shift the culture. Do you know how many abortions are committed in Tennessee? At last reporting, you've heard it here today, 10,880. And the gentleman asked earlier if a woman could get the fetal remains and cremate them from the abortion clinic. Well, I called Knoxville Clinic this morning and I spoke to the director, Carolina, on the phone. And I asked that specific question after I tried to make an appointment for an abortion as if I was a woman who needed one. And she told me that it was illegal for her to give me those remains because they were considered biohazardous waste. Knoxville Clinic does abortions on Mondays and Thursdays. Those are the only days that they perform abortions. So the numbers you heard earlier reflect that. Do you know the numbers for other causes of death in this state? In this state, abortion killed more humans than homicide, suicide, accidental causes, and motor vehicle accidents combined. Only heart disease and cancer outnumber abortion deaths in your state. Where are those 10,880 humans that died last year? Did you receive the reports with the disposition of their remains? This is about responsibility, plain and simple, and I'm asking you to follow through. Who will assume final responsibility for the disposition of these human remains? You have an opportunity today to restore dignity to the lives of over 10,000 humans who are killed in your state every year on your watch and under your leadership. What you do today will resound in eternity. Today, I've given you the choice between life and death, between blessings and curses. Now I call on heaven and earth to witness the choice that you make. Oh, that you would choose life so that you and your descendants might live. Thank you.
Thank you. Representative Cheryl, let me get that out. I think you had a question for her from the previous. You're recognized.
Thank you, Chairman. Yes, thank you very much again for you ladies being here today. What a testimony to sit here and listen and comprehend what we in America or here in Tennessee are doing with lives, and they are lives. As I asked a question earlier, and I asked it in subcommittee the other day, about how many, and thank you for bringing the answer that 10,880 in Tennessee. And did we have a number of how many is in the United States abortion?
You're recognized.
Over 1.2 million. And over 330,000 of those are done at Planned Parenthood.
All right.
Thank you.
You're recognized.
And I know in subcommittee this was talked about, and one of the ladies that was testifying in subcommittee the other day, thinking about somebody that has the guts, if you want to say, that can take a baby, which is a person, out of a mother's womb by piece, pulling the head off, pulling the arms off, pulling the torso off, pulling the legs off, and then somebody sitting there or standing there putting this baby back together to make sure all the parts are back together. We're in a sick society. And I appreciate Representative Rudd bringing this bill. I didn't have the clue that this was happening. I was raised on a farm. I know what we done with when we had a dog die, we had a cow die, we dug a hole and we buried it. That's what we done on the farm. I didn't realize that we was putting lives in the garbage can or putting them in a landfill, putting them in a grinder and grinding them up. We're in a sick society. Thank you, ladies, very much.
Thank you. Any further questions for this witness? Okay. Thank you for your testimony. Appreciate it. Looks like we have a Max Carwhite. Carwile. Okay. You are, give us your name and who you're with.
My name is Max Carwile, and I work at Planned Parenthood of Tennessee. I want to first say thank you all for having me here today. I've never spoken in front of a legislative body, so this is pretty exciting. I wish it was on happier subjects and not ones that I find extremely upsetting. I'm a born and raised East Tennessean, born in Knoxville, raised in Knoxville, or born in Morristown, raised in Knoxville, went to ETSU. And I'm here to talk about what all this looks like here in Tennessee, because we haven't heard a bit of that here today. Like I said, I am a current employee of Planned Parenthood of Tennessee and North Mississippi and a former employee of Knoxville Center for Reproductive Health, where there's no employee named Caroline. I'm opposed to this bill because I do not think our government should be in the business of legislating whether to or how we should grieve. Through my work on an abortion storytelling program called the Tennessee Stories Project, I have heard countless experiences of people sharing what it was like to make the decision to end their pregnancy here in Tennessee. Many factors and emotions go into these decisions, and it is pure government overreach to dictate how our patients find closure or heal if they need to. I am also someone who's had an abortion here. As the very population this bill attempts to affect, I oppose it. Like some of the previous speakers, I have also been on all sides of this debate. Through my work at the Knoxville Center for Reproductive Health, I sterilized medical supplies following in-clinic abortions in the same room that the doctor handled the medical tissue, and I learned a great deal about the care and respect with which medical tissue is handled following an abortion. Health centers comply with all state laws regarding fetal tissue disposal, which is handled by the same professional removal companies, not grinders, used by other healthcare providers for other medical material. Health center staff here in Tennessee also talk with patients on a case-by-case basis to answer all of their questions about how fetal tissue is handled. And these are just a few of the reasons this bill is unnecessary here in Tennessee. Again, I can't speak to what other states are like, only Tennessee. It's incredibly clear that this bill isn't about giving people seeking abortion care options. It's about limiting which options exist for us. There's no medical or rational justification for treating tissue from a procedure performed at an abortion clinic any differently than tissue from procedures performed at hospitals or the embryos that fertility clinics must dispose of. This bill is about nothing other than stigmatizing and harassing abortion providers and their patients. This is yet another in a long line of extremist attempts to end abortion in Tennessee. Under this bill, patients wouldn't even have the option of sending fetal tissue to pathology like hospitals have. This is treating it as a specialized area of care and specifically targeting abortion providers. I heard the sponsor talk about how he doesn't believe this will affect abortion care, and I recognize he's never worked in an abortion health center or talked with us, so he doesn't understand this fully, but it will affect us. We do have to figure out who is going to take care of the burials and the cremations and work with us. We don't know what the costs are going to look like, and in many ways, this feels specifically like an abortion tax on us. I really appreciate you all taking the time to listen to me and consider this bill seriously, and I really hope you will oppose this bill.
All right. Thank you for your testimony. Are there questions for the sponsor? Representative Sherrill, you are recognized.
Just a comment, or maybe a question would say, isn't doctors, don't they go to school to save lives instead of to take and kill lives?
You are recognized.
I am not a doctor and I did not invent medical schools, so I don't think I'm the best person to answer that question, but I will say that the answer of life is a complicated question, and we as human beings do not get to decide that. Some people have different beliefs on when life begins, but we know that politicians, no disrespect intended, are not the experts.
I believe that, to my understanding, thank you, Chairman. I think to my understanding that we have some great doctors in our lives, and I think you said something about it takes a doctor to perform a abortion. I believe we have great doctors like Dr. Kumar sitting here beside of me that tries to save lives, and I believe this man has a heart, but I believe these people that perform abortions don't have a heart. But thank you very much.
Any further questions for the speaker? Okay. Chairman Kumar, you're recognized.
Thank you. Thank you for all of you who have testified for your courage and the points that you're making. I think our Legislative Assembly is composed of thoughtful people who will decide really based on their own values. I want to thank Representative Sherrill for complimenting me. Just to clarify, in the original Hippocratic Oath, abortion is not allowed. I'm taking a life is not allowed in the original oath. But then as life moves on and revisions happen, it was in 1964, a physician by the name of Dr. Louis Lasagna, easy to remember, at Tufts University, he did the revised oath in which this was left out and certain other things, including prayer to God. The original Hippocratic Oath opens by a prayer to Apollo. That is what was the god at that time. God was taken out, a prohibition against abortion was taken out, and membership to AMA was put in. Those are the times we live in, how things have changed. But I just wanted to clarify that in the original oath, it was against, again, our job was to totally pro-life, support life in every way that we can. And thank you, Mr. Chairman.
All right. Thank you for the history lesson. That was good. Representative Clemens, you're recognized.
Yeah, thank you, Mr. Chairman. I just had a couple of questions or clarifications, and thankfully, medical science has improved since Hippocratic Oath originated from Greek. But anyway, how many surgical abortions can be or are performed at a clinic a day? I heard 50. That seems like a lot to me, but it may be accurate. Can you answer that?
You're recognized.
Thank you. Thank you. That's a great question. While I don't know the specific numbers, because obviously things change over time and depending on what laws are in place, how hard things can be to access in different states, I know that 50 is a lot more than ever happened in a single day at the health center I worked at, Knoxville Center for Reproductive Health. I also believe some of the previous speakers got a little bit confused and were adding together the totals of medication abortion and surgical abortion to get to that 10,000 number. So then when you're dividing that to get to how many surgicals happen in a day, that seems to be a little bit messy. And I imagine where their math got a little confused.
Representative Clemens.
Yeah, thank you, Mr. Chairman. And well, I'm sorry, I have a lot of questions, but I'll leave it at that. Thank you, Mr. Chairman.
Thank you. Chairman Williams, you're recognized.
Thank you. Thank you for your testimony today. We don't see each other from the same view, but that doesn't mean it's not your view. And so I can appreciate that. I will say, you testified that you dispose of medical waste much like other medical entities would. I guess the question as it relates to medical waste is, do you see a difference between, say, a non-cancerous tumor and an aborted fetus?
You're recognized.
I think that is a complicated question where I am not a medical expert. I'm not a doctor. I don't feel qualified enough to go to answer that. I think for individual human experiences and how they feel about their bodies and procedures, that's a whole other complicated area. So I think when we talk about the differences between the two, I don't think there is an actual answer there.
Chairman, you're recognized.
Thank you for your answer. I think for me, if I were to treat a tumor and a fetus the same by putting them in the same place, then my actions would determine what my view is. And I think in this instance, when we're told by your testimony that you are disposing of fetal remains as the same as another medical provider might a tumor, then by the nature of your view, you dispose of it that way. I think the challenge, which my colleagues on both sides of the aisle would say, is that this is a very polarizing issue on either side of the debate, and so it makes it very difficult. But I think that most of us view this as, at least in this state, would view those fetal remains as just, in fact, a child and not a mass or a tumor that someone would have removed. My colleague from Nashville communicates very well about the changes of the Hippocratic Oath and how they were a dark age of years gone past. But I think over time we've lost our way in a lot of ways. And in this case, even in the last 40 years, the science and the miraculous events which occur in the womb, we know way far better today than we did then. It's not a dark place of the unknown as it were in the late 60s. And so I think that's what complicates the situation, because we are wiser and technology shows us four-dimensional photos of what we once knew as a dark void. And so I want to thank you for your testimony today, and I appreciate you answering my questions.
And can I
You're recognized.
Yeah, thank you. I really appreciate you saying that, because I am not going to pretend like all of this is not complicated. I actually don't believe this is an either or issue of us, them, pro-choice, pro-life. I believe everybody has very complicated, nuanced ideas on abortion, and that should be allowed. But when we have our government making these uniform blank policies, that can't really be allowed. And that's where I'm coming from, is the concerns about government overreach, because you talked about the historical perspective. And one thing I have found in my studies is that abortion has always existed as long as humanity has existed. There's evidence of abortion over 4,000 years ago. At the same time of the Hippocratic Oath, there were sort of jokes about a Hippocratic method of trying to induce a miscarriage by jumping up and getting your heels to touch your buttocks. Abortion is something we will always need and always look for, even when it is made incredibly difficult to access, like bills like this attempt to. And I want to make sure that abortion is safe and legal.
Chairman Williams.
I respect that, but I couldn't disagree more. So thank you.
Thank you. Representative Clemens, you're recognized.
Yeah, thank you, Mr. Chairman. I appreciate you coming back to me, and I appreciate my colleague from Putnam County's questions. I think his question was a fair one and really placed this difficult topic into a good window for discussion. Aside from that, I'm curious, are you able to speak to when of those 10,800 abortions, or whatever that number was, how many of those are performed in the first trimester? Are you able to answer that question?
You're recognized.
I don't have the exact number off the top of my head, but it is the vast majority, definitely at least 90%, especially most of the abortion providers in the state of Tennessee, because of only providing medication abortion, only go to 10 or 11 weeks. And then most of the surgical facilities also only go to about 14 or 15 weeks, just a few weeks after that first trimester. So it is the vast, vast majority. And when we talk about abortions that do happen later in the first trimester, that's where we are talking about hospitals, which this bill doesn't cover.
Representative Clemens.
Yeah, thank you. And that's my point. We've heard some very shocking, graphic explanations of the alleged process here and what's happening. And so, I'm speaking as a layman, and what a fetus looks like at that period of time where these abortions are taking place. And I'm trying to get the two, reach some agreement there with the context of the testimony we've heard thus far, with what's actually happening, the type of ones we're seeking to regulate. So if you want to respond to that, that's fine. If not, I appreciate your testimony.
Thank you. Okay. All right. Any further questions? Okay. Seeing none, as you head back to your seat, I do want to thank all the those that came and testified. Respect your opinions, respect your right. Again, thank you for coming and testifying. So without objection, we will go back into session. And before we get to the sponsor, I do want to address something that was brought up out of session. We do have an induced termination of pregnancy report here in Tennessee. The latest numbers that we have on the website, 17.8% less than 7 weeks. 35% are between 7 and 8 weeks. 22%, 9 to 10 weeks. 11 to 12 weeks are at 10.9%. Above that, there are 6.6, 3.3, 3.1, and 1.0. So there is a report out there. That report should also include this year what percentage of those had heartbeats. So, and that was a bill that I passed. So anyway, Chairman Rudd, you are recognized.
Thank you, Mr. Chairman, for the information, and thank all of you. I think I've explained the bill, and again, this is in no way, shape, or form limiting an abortion or access to an abortion. This is simply trying to create the remains of a human being with dignity at a very minimal cost and a very minimal a choice. It's two choices. If they don't want to participate, they can walk away. The facility will take care of it. And this is in no way meant to harm anyone, but protect the rights of a child, which some people here refer to as tissue. It is a human being. And whether that, and how far along that is, whether it's almost right up to birth or besides, they should be treated with dignity. And also, I'll address one other thing that was asked. You can't walk into a Tennessee hospital and ask for an abortion because you don't want the child. Abortions are, the life of a baby is terminated in a hospital, as you doctors on the committee know, because the life of the mother is endangered, or because of a miscarriage or the death of a child that's in the womb has to be removed. It is not an abortion, elected abortion on demand for convenience. It is strictly for the health of the woman. And that, unfortunately, is not the reasons abortions are created in clinics. And those babies that are being aborted for surgical or health reasons in a hospital, which are rare, are treated with dignity currently. It is their practice. And we just want that same level of dignity for other facilities. Thank you.
All right, we are on the amendment. Is your question on the amendment? Okay, Representative Clemens, you are recognized.
Yeah, thank you, Mr. Chairman. And again, this question goes back to from the witnesses. The definition of fetal remains in this bill, and legal may need to answer this because I don't know the answer. Is fetal remains defined anywhere else in the code? Because this definition of fetal remains only means an aborted fetus or fetal tissue that results from an abortion of an unborn child. If that is the sole definition of fetal remains in the code, then what is the definition of fetal remains from a miscarriage?
All right, without objection, we will go out of session. Matt King, you're recognized.
Representative Clemens, there's no other definition of fetal remains currently in the code.
All right, without objection, we will go back into session. Representative Clemens, you're recognized.
Yeah, thank you, Mr. Chairman. So that is a serious concern of mine, that I don't know how we can exclude fetal remains from this definition in the instance of a miscarriage, just for purposes of cleaning up the bill. I know that women, a lot of women, more than we probably realize, have miscarriages. Those of us who've experienced it, it's a very difficult process, and to have what was miscarried not be contained within the definition of fetal remains is very concerning to me and could be offensive to families. Thank you.
All right, Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. I missed it earlier. I'm just trying to figure out who is going to pay for this cremation process.
Chairman Rudd.
Yes, that's been discussed earlier. What the bill calls for is that the mother has a choice. First of all, what this bill basically does, and I'll describe it since you weren't here. Upon the baby's death and in a clinic where there's an elected surgical abortion, the mother would be asked, how do you want to handle the remains of your child, by cremation or by burial? And if she chooses not to participate, walk out the door, her responsibility ends. And it would be if she chooses not to handle it, not to send it to a funeral home, not to take the two options there, then she, at that point, would hand that over to the abortion facility and they would be responsible for it. And in some cases, there are nonprofit charities that also assist with this if she chose to take another path and take it to a funeral home and bury it.
Representative Mitchell.
Okay, so I'm just trying to get, so it's kind of along the same lines as Representative Clemens. So fetal remains, I think it gets into question, when does life begin? In your mind, when does life begin?
Representative Rudd.
Well, that's a matter of opinion. In my opinion, it begins at conception. And some people may say it's the first trimester. It may be before. A fetal remains is a fetal remains of a child that started to form in the womb.
Representative Mitchell.
So with your, when you describe as life beginning, that kind of gives me concerned about, other places in Tennessee. I don't know if you're aware of it or not, but we have the National Embryo Donation Center for the country here in Tennessee. And so there's a lot of people from all over the country that after, they pay so much per year to preserve their embryos, and then they decide, hey, we're through having children now. We're not gonna, pay that $500 anymore. They're just taken out of the freezer. So, if your legislation is going to affect, certain centers, I think by your definition of life, don't you think you ought to, make sure it affects that as well? Wouldn't that bother you as well?
Chairman Rudd.
No, and legal maybe could answer that. I know that there are certain federal and there are certain federal guidelines as far as what you're talking about. My bill doesn't address that. It only addresses if a child is going to be left at the abortion clinic or some other facility where they don't want the child, how it's to be disposed of, and she's given a choice.
But
Chairman or Representative.
But
Mitchell,
I mean, the dignity, we were talking about the dignity of all. You're picking and choosing who you want to choose dignity for. And you specifically said, well, no, I don't want to get into that. But yet you're into it. You don't get to pick and choose who you choose dignity for in society. If you're going to do it, you're doing it for everyone, or don't do it.
At no case did I say I'm choosing dignity. That is not what I said. I said this is choose dignity for the child. You went beyond that in your statement. I think I refer back to what Representative Williams said when he asked a question during the out of session, is that your definition and your reality is different than mine. To you, it's not a human being and it's tissue. Or to those who are opposed to this bill, many of them, to me, it is a human being and it should be treated with some level of dignity. And I think that to justify the actions over the last 50 years, we have dehumanized the whole process. And I'm simply trying to bring a little humanization back to it, a little bit of dignity.
Speaker Marsh, you recognize? All right, question's been called on the amendment without objection. We are voting on amendment 5537. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. Any further questions? Question's been called. Seeing none, we are voting on House Bill 1181 as amended. All those in favor say aye.
Aye.
Opposed? No. Ayes have it. Bill goes on to government operations. If you wish to be recorded as a no, tell the clerk. All right, that brings us to item number 4, House Bill 578 by Chairman Reagan. You're recognized. You have a motion, a second.
Thank you, Mr. Chair and committee. I bring before you a bill that was in this committee last year and passed. Unfortunately, the Senate chose not to act on it because of COVID routines, and I have an amendment that rewrites the bill. The amendment code is 6059.
The amendment has not been filed with the committee. I do not believe it's been filed with the committee.
Mr. Chair, this is the committee you and I, or the
Yeah.
amendment we discussed, and it was filed immediately after it was drafted.
Let's see. Give me just 1 second here.
This is what we've got on our mark calendar. It's a different number. It's that.
I think that is the same amendment, I think.
Yeah. Okay. Yes, we don't have that amendment in our amendment pack.
Mr. Chair, if I may, the number you have in your amendment pack is 6196, is
Yes.
that correct?
Yes.
I believe that's the same wording as the amendment that I have under this number. I will be glad to put this amendment on there and then discuss it as it goes.
That was one that I had filed, and I would move to withdraw that one. I'm not going to run that amendment. So the
Okay.
amendment that we do not have your amendment. Chairman Ramsey, you recognize?
Thank you, Mr. Chairman, and thank you, Mr. Sponsor. We talked earlier in the day, and I didn't blindside you on this. I have some concerns, several, in fact, from professional organizations that and I think you told me that you had considered amending those previously in one of the other committees. I think one of the justice committees. So with the late hour and the question about the information and the fact that we do have another bill next week, Dr. Kumar's bill, which is very similar to this, and we actually have some testimony on that bill, which will be very give us a qualitative facilitation with both of them. I would ask that we maybe roll this till next week.
I'm at the will of the committee.
All right.
Considering the last bill, you all are tired, so I
Okay.
fully understand.
All right, so without objection, we will roll House Bill 578 1 week. Thank you.
Mr. Chair, if I might ask a question there.
Yes.
That doesn't roll this to that special calendar, does it?
No, we will bring you up first.
Thank you.
Okay, that brings us to item number 5, House Bill 1356. Chairman Ramsey, you recognize. You have a motion second.
And thank you, Mr. Chairman, and I did not ask for a roll on the previous bill so I could be heard. I know it's very suspicious looking. But this is what we have named the James Dustin Samples Act. James Dustin Samples was a heroic firefighter that spent years and actually had I think other family members that were involved in firefighting. And the stress and the difficulty of that job has proven to us that sometimes we always revere the bravery and sacrifice of our first responders, and we've had several bills this year that actually raised the increase of a penalty for harming or killing one of our first responders. And this bill seeks to tackle a situation that developed with James Dustin Samples. Research has confirmed by what we're hearing from firefighters and heartbroken families across the state that one of the biggest threats to our firefighters is not harm from outside, but suicide. So by working to remove barriers to care and reducing the stigma attached with seeking mental health resources, the goal of this bill and our culture within the fire service is that we encourage a protective approach to addressing the mental health injuries early before it's literally a life-threatening situation or emergency and actually try to get these folks in a situation that they can actually go back to work. The current protocol for a firefighter is that they must identify a singular incident to prove a cause and the presumption that PTSD is involved with their work. And PTSD does not fit the actual scenario in a fire service. So this bill states that there is a presumption that when a firefighter seeks treatment for PTSD, that it is a work-related injury. That is always has an investigation, and there has to be proof of that. But the presumption benefits and brings these folks forward. Just about all of you have signed on to this bill in the past, and I ask for a favorable vote and welcome your help in moving this bill forward this year. So with that said, sir, I would renew the motion.
Okay, any questions on the bill? Okay, seeing none, we are voting on House Bill 1356. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to Finance, Ways and Means. That brings us to item number 6, House Bill 670. Representative Freeman, you are recognized. You have a motion and a second. There's an amendment 6144. Is that correct?
Yes, sir.
Okay, you have a motion second on the amendment.
And the amendment makes the bill. Several years, early childhood education providers have been unable to get consistently reliable information from the Department of Human Services. And what this bill does is require a specific person within the staff, in addition to their other duties, to act as liaison to provide an official uniform message to program educators and evaluators, and does not have any fiscal impact and will not require a new position. Just somebody has that as their job. With that, I ask for your support.
Okay, any questions on the amendment? Okay, seeing none, we are voting on amendment 6144. All those in favor say aye.
Aye.
Opposed? Okay, ayes have it. Okay, we are back on House Bill 670 as amended. Any questions from the? Nope. Okay, seeing none, we are voting on House Bill 670 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right, that brings us, we have rolled item number 7, brings us to item number 8. I do not believe that we have time to hear that before the committee closes. So without objection, that will roll to next week's calendar. With no further business before us, we are, before we leave, Representative Smith, you're recognized.
I just wanted to bring the membership's attention to the passing of Charles Coolidge, Tennessee's last and longest living recipient of the Medal of Honor. The Medal of Honor Heritage Center in Chattanooga is named after him. He died at 99 years of age in the wee hours of the morning, and there'll be tributes, but I'm sure that we will invite the membership and particularly the Veterans Caucus to participate in his service. Thank you, Mr. Chairman.
All right, thank you. And seeing no further business before us, we are adjourned.